So you may have difficulty breathing through your nose. We call that nasal obstruction, meaning that airflow through your nose is less than you'd like it to be, and you really have a difficult time breathing through your nose. There are many reasons for that, but there are several anatomic structures that can affect that. One would be the septum. So you may have heard of the deviated septum. That's the cartilage and bone in the middle of the nose that causes difficulty breathing if it starts to deflect to one side or another. This is usually something that happens as you develop in your teenage years, but can happen after trauma to your nose, such as a nasal fracture, or as you get older. There's also structures that come out from the side of the nose called the turbinates, specifically the inferior turbinates. They have vascular tissue, blood vessels, that swell up in response to allergies or infections. And you may note that one side of the nose may clog up and alternate, so the other side clogs up. This is normal in people in that there's something called the nasal cycle. Every 4 to 8 hours, one side swells, one side shrinks. But if you notice it significantly, your turbinates may be very swollen. The other area of the nose that causes issues is the nasal valve, which is just underneath the nostrils between the septum and this soft part of the nose here called the ala. And if that area is tight, it may cause decreased airflow. So what can be done for these? Well, medical treatment is often something we will start with, especially if your turbinates are swollen. So we'll look to see, do you have a sinus infection? Do you have allergies? There are topical nasal sprays or an oral antihistamine to treat allergies. Even if you don't have true allergies, but we have what we call non-allergic rhinitis, the nose sprays will help. In our office, we also have allergists that can test you for allergies to see if that's an issue. If medical treatment is not sufficient, then surgical options can be done in the office or the operating room. The septum itself usually has to be treated with surgery in the operating room, but the turbinates, which come out from the side of the nose, can be shrunk in the office under local anesthesia. And the nasal valve can be addressed with procedures such as Vivere, which you may have heard of, that can be done in the office under local anesthesia, which are well tolerated and have a very short recovery so that you can go home from the office and resume work within several days.